Christina Felton. I am the Chief Operating Officer here at AgeSmart Community Resources, but that's not why I'm standing up here this morning. I am also a Senior Health Insurance Program Counselor and Coordinator, and have been doing this work for 20 years. So that's why you get me today for Medicare 101. I'd like to thank you for coming and joining us this morning, because this is such a riveting, exciting topic. Medicare on this. But then again, it's hot outside, so at least we're in the air conditioning for this. Just so I know who I've got here. How many people are currently on Medicare? Okay. How many people are getting ready to start Medicare in the next couple of years? Okay. Anybody here because they live with somebody who's starting Medicare and they want to know what's going on? That's what my husband tells people. He goes, that's okay, I got Chris, and I look at him, I'm like, you're a SHIP counselor too. Do your own Medicare on this. Okay, so Medicare 101. We're going to go over the basics. If you have a question, stop me. I have no problem being stopped in the middle of the presentation with a question on that. So, this is Medicare. It's been Medicare, this has been Medicare since I started. When people start talking Medicare, this is what a lot of people think on this. Okay, Medicare, what it is, who it's for. It's a federal program that provides health insurance to people 65 and older and people with a disability. Simple. It has 4 parts. It's run by the Centers for Medicare and Medicaid Services, CMS. Now, here in the great state of Illinois, we have another CMS. If you know somebody who worked for the state, they have to go through Illinois Central Management Services. So in the state of Illinois, we have to be real careful when somebody says CMS. Are they talking about Centers for Medicare and Medicaid Services? Or are they talking about Central Management Service on this? Eligibility for Medicare is determined by the Social Security Administration. I'm going to go back to this. You cannot walk into a Medicare office. There are Medicare offices, that's where the Medicare staff works, but you cannot go into a Medicare office anywhere in the country. You can, however, go into a Social Security office. And I'm glad Missy didn't laugh on that one. Social Security is the one that says, yes, Chris is 65. She will now be eligible for Medicare. And they send that information to CMS. Once I have gone into the Social Security office and said, hey, I'm turning 65, I want my check, I want my Medicare. And then Social Security will let CMS know. Same with disability. Do you have a question? No. Oh, no. Okay, 4 parts of Medicare. We're going to start with Part A. Part A is free to anyone who has 40 quarters of work in. It's roughly 10 years. You get your Part A free. This covers hospitalization, skilled nursing, home care, and hospice services. It has a deductible per benefit period, meaning that if you go into the hospital on February 1st, you stay in the hospital for 5 days, you come out, you go back in 10 days later. So you come out on the 5th, you go back in on the 15th. You're still in that benefit period. If you go into the hospital on March 1st, you stay for 10 days, you come out, and you're out for 63 consecutive days, and you go in on this back into the hospital on the 75th day, you're in a new benefit period. And this is important when you start looking at the deductible. The deductible in 2026 is $1,736. So I go into the hospital on March 1st. I stay through March 10th. I only have, say, Medicare Part A. I'm going to be responsible for $1,736. If I come out on March 10th, I stay out, I go back in, 75 days later, I'm going to owe another $1,736. Yes, ma'am?
Does your secondary pick up your deductible?
We're not talking about secondary right now. Okay. We're starting strictly Medicare Part A. That's all I got. So that's how that goes. Now, if I go into the hospital and I'm there days 1 through 60, I pay the $1,736, I'm done. If I stay for days 61 through 90, I will have a $434 a day copay on top of this $1,736. If I stay days 91 through 150, my copay jumps to $868. Now, everybody says, 90 days, that's 3 months in the hospital. Yeah, but if you look at a benefit period, I go in on March 1st, I stay for 10 days. I come out for 20 days. I go back in for 10 days. I'm out for 30 days. I never hit that 63-day out of the hospital. I can jump up to day 61 through 90 or 91 through 150. So that's how it kind of builds up. So that's the hospital. Skilled nursing daily co-insurance. Days 1 through 20, there's no copay. Medicare picks it up. Days 21 through 100, there's a $217 a day copay. Now, for Medicare to pay for skilled nursing, think rehab. Also, 3 midnights in the hospital. If you do not have those 3 midnights in the hospital, Medicare will not pick up these 20 days of skilled nursing for that. So you go in, you have a knee replacement done. Usually they keep you the 3 to midnights because they know, the hospitals know. And they send you to rehab. Rehab picks up the first 20 days. Medicare picks up, sorry, not rehab, Medicare picks up the first 20 days. But if you stay day 21, then you have a $217 copay.
Per day.
Per day. Per day. Days 21 through 100 are daily copays for that. Now, Medicare will cover up to 100 days in skilled nursing. Don't count on it. Because anytime somebody goes into rehab, and you go into rehab and we'll go with the knee replacement. And when you get there, you can't walk from the bed to the bathroom. Well, then you can walk to the bathroom, and then you can walk out in the hall, and then you can walk down the hall, and then you're walking around the building. You're fine. You're getting better. If at any time you stop making progress, and Medicare gets that report from the rehab skilled nursing facility, they will stop the Medicare. So that's why people will come and give us a call and say, Mom's only been in there for 45 days and they're going to stop Medicare. Mom's apparently stopped making progress. So now Medicare's not going to pay. Anything after 100 days, if you're still there, Medicare is considering that a permanent move. Meaning you've moved into the skilled nurse.
So
yes.
Are those considered just short term then?
Yeah, this is short term. Think of these 100 days as rehab. You're rehabbing from something. And it could be an acute rehab. It could be a case of maybe you had surgery, you went home, and after a couple of days you realize, I should not be home by myself. I don't have the strength, you can go into what's called an acute rehab. You can call the doctor's office and they can get you into acute rehab. And then you start with the 100 days there. But yeah, this is all short term. Medicare does not pay for any long-term nursing home.
But that's different for people that have an Advantage plan, correct?
Correct.
Because my mother-in-law's going through that now, where they're trying to kick her out all the time after just a couple of days.
Most nursing homes will try to get people out in the first 20 days.
That's why I kept asking, what do you consider short term? What's the final day of short term? And if you read it online, it'll say up to 100 days. But as soon as they tell them, well, she walked today, well, okay, we need to get her out of here.
Well, and then the other thing, and we will get into it more with the Medicare Advantage plans, there's a whole kind of different set of rules with those than there is with, we're talking original Medicare right now. We're getting the basics down here. All right. Yes, sir.
You spoke of the 3 midnights. So if you go to the emergency room for 1 midnight, then you get admitted to the hospital for 2 more midnights. That's not 3 midnights.
That is not 3 midnights because that first midnight you were not a patient if they had not processed. That's the other thing with the 3 midnights is there is a situation where you could be under observation status. And here's the problem. They say, oh, maybe you were in the hospital for something, and something happened and you came back through the ER, and they're like, we're going to keep you under observation status. They roll you up to a room. It doesn't look any different than if you were an inpatient. They are supposed to give you, within 24 hours, what is called a moon notice. Medicare something observation notice. It's a moon, M-O-O-N, on that. And you are supposed to receive that within 24 hours. Most people, if they're going into the ER and somebody rolls them up to a room upstairs, they don't know if they're there under observation or if they're an inpatient on that. So observation status nights do not count toward this, 3 midnights, because you have to be an inpatient on that. Lots of rules.
Medicare outpatient observation notice.
Thank you. Medicare outpatient observation notice. Okay, moving on to Part B. First line up here says optional. You don't have to take Part B. You don't ever have to take Part B. If you don't take Part B, you're not going to have that coverage. And if you decide later on, in certain circumstances, there could be monetary consequences if you don't take it when you're first eligible. And we will get into those later. So Part B covers your doctor's visits, lab tests, x-ray, durable medical equipment, some medications. There are medications that go into like breathing machines. Those medications are covered under B, as are immunosuppressors after a transplant. Those medications are also covered under B. There is a monthly premium everybody pays, $202.90 for 2026. You have a once-a-year deductible. So Part A, you had a benefit period. For Part B, it's once a year. You pay your $283, you're done for the year on that. And then there is a copay, co-insurance, normally 20%. Think Medicare Part B, Medicare pays 80%, beneficiary pays 20%, roughly, on that. Part C. Part C is the Medicare Advantage plans. This is what takes Medicare Part A, Part B, and a lot of the times Part D rolls them into one. You carry one card. It's in essence a Blue Cross Blue Shield, the United Healthcare, whatever. It all rolls it together. These are health maintenance organizations, HMOs, preferred provider organization, PPOs, and private fee-for-service plans. We don't have a lot, but we still have some on that. Premiums paid for by a combination of Medicare and beneficiary. What makes a Part C plan attractive to a lot of people? We got some seats over here too.
Oh, okay.
Part C plans is a lot of them do not have any premiums on it. And everybody's like, I can get a Medicare Advantage plan for free. We all know there's nothing free in this world. So there is a payment going on here, and it comes from a combination of Medicare and sometimes the beneficiary when there is. So Part C plans are all over. These are the ones you see advertising on television and all that. Okay, Part D. Part D is also optional. Again, like Medicare Part B as in boy, there could be consequences if you do not take it when you are first eligible for this. Part D covers prescriptions, medications, premiums are paid by the beneficiary, and there is an annual deductible of up to $615 for 2026. Does it mean that all Part D plans have a $615 deductible? Some of them can have a $400 deductible, but they can't be over $615. All right. That's the 4 parts of Medicare. Anybody have any questions before we go on? Okay. So, how does it all work together? Well, first you jump in the maze and you run around until you figure it out. Okay. Medicare basics. If Medicare is going to pay for something, 3 things have to happen. 1, it has to be medically necessary. 2, it has to be doctor authorized, and 3, it has to be received from a Medicare approved provider. So, somebody needs a walker. Doctor says, yes, you need a walker to help with your balance while you're moving. Writes an order for it. You go to a durable medical provider and get your walker. They will bill Medicare. There will probably be a copay for it because durable medical equipment falls under Medicare Part B as in boy. And remember, with Part B, Medicare pays 80%, beneficiary pays 20%. On that. Now, if you run down to Jim Bob's Durable Medical Equipment R Us that does not have a contract with Medicare, Medicare is not going to pay for that walker. And you might laugh when I say that. I mean, in Chicago, in an Uber going to the hotel for a conference, we were at a stop sign, and I look over, there was an 18-wheeler trailer. And it had something like Jimmy's Medical Equipment on. Graffiti, spray painted on the side. I asked the Uber driver, I'm like, what's that? He goes, oh, he sells medical equipment. He says, I don't know where he gets it. He says, my guess is he probably steals a lot of it. He said he'll sit up on a corner for a while, sell medical equipment, and then move on when the police make him move. Jimmy's not billing Medicare for that stuff. I know he's not on that. But something like that. And I thought, I can't believe I actually honestly saw that. He goes, oh yeah, he's all over the city. Okay, never heard of it before. But you want to go to some place that has a contract with Medicare to get it. And you want to make sure you're getting what the doctor ordered. You go in for a walker, don't let them try to sell you a scooter on that. Okay, so we talked about the 4 parts. We talked about what it is to get Medicare to pay for it. So, Medicare Part A and B are what's considered original Medicare. So when you hear somebody say original Medicare, they're talking about Medicare Part A and Medicare Part B. Medicare Part C, we already said, is a combination of original Medicare and a prescription drug coverage. All puts it in one neat package, carry one card. You can get a Part C plan, a Medicare Advantage plan, that does not have prescription drug coverage on that. Most of them do. And then Part D is a standalone. Enrollment for Medicare. You're eligible for all parts of Medicare at age 65.
I have a question.
Yes.
So, is there any prescription covered under Parts A and B?
Under A and B?
Yeah.
The only prescription coverage is under B, and it is for medications that go into, say, breathing machines, and they're called nebulizers. So the medication that goes into that is covered under B, as are immunosuppressors after a transplant. They're covered under B. The reason for the immunosuppressors being covered under B is because Medicare finally realized they were paying for these transplants, and this is prior to 2005 when Medicare Part D started, but they were paying for transplants, and then people couldn't afford the almost $4,500 a month in immunosuppressors to keep those new organs alive. So they started covering the immunosuppressors under B, and that's why those medications are covered under B and not under Part D on that. So, eligible at age 65. You enroll through the Social Security office. So if you have not already started receiving Social Security benefits, because you are eligible at the age of 62 to retire and get retirement payments. You don't get Medicare until you're 65, but you can get, if you have not enrolled for payments to Social Security, you need to contact Social Security about 3 months prior to your 65th birthday and say, hey, I want to get my Medicare. And they will get you signed up. Now, what you do at that time, whether you take A and B or just A, depends on your situation, and we will get into more of that later on. You will get a red, white, and blue Medicare card with your name and the date of your eligibility. It'll say hospitalization, it'll say medical, and the date it started with your name on it. On that. Part B payment will be taken directly from Social Security check if you receive one. If you do not receive a Social Security check for whatever reason, whether you've decided not to take it yet or you're delaying payment, whatever, you will get a bill every 3 months for your Medicare Part B premium. So about a $606 bill every quarter that you have to pay directly. Enrollment periods. When can I enroll in Medicare, Chris? Well, your initial enrollment is the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. So, my birthday is in May. My initial enrollment period begins in February. I have February, March, April. 3 months before my birthday. The month of my birthday, May, and then I have June, July, and August. I have 7 months to get all my stuff together. We do recommend you do it prior to the month of your 65th birthday. Then everything is in place. They do not, it doesn't, well, if your birthday is on the 10th or the 25th, doesn't matter. Your Medicare is going to start on the 1st. They don't play that, they don't wait until the 15th when your birthday is. They just started on my birthday's in May, mine will start May 1st on that. There is an annual enrollment period. The annual enrollment period is October 15th to December 7th. I'm proud of you two for not shuddering. That is a very busy period here in our office because this is the period where Medicare beneficiaries can start, stop, or switch on it. They can Medicare Part D, a Medicare Advantage plan, they can do during this period. General enrollment is January 1st to March 31st. So, let's say I turned 65. I chose, for whatever reason, not to take Medicare Part B. Maybe I didn't want to pay the $202 a month. I'm 65, I didn't take my B, I don't have any other insurance, I just have my Medicare A. Maybe I picked up a D plan. And 5 years later, I'm like, better pick up my Part B plan. And it's July. So I go into the Social Security office and I said, I want to enroll my Medicare Part B. And they said, see you in January. Because I have to wait until January 1st to enroll. So I go back in January, find out what my penalties are going to be, enroll, and my Medicare B will start February 1st on that. But I will have a penalty I'm paying. The Medicare Advantage enrollment is the same time period, January 1st to March 31st. In this time period, you can switch Medicare Advantage plans once. I'm checking with Missy because I have not worked annual enrollment period full time for quite some time. You can switch your Medicare Advantage plan. You can drop your Medicare Advantage plan, go back to a supplemental if you had one, pick up a supplemental, and get a Part D. And you can do it once on that. And whatever you do takes place the first of the following month. So if you do it in February, it takes place March 1st. If you do it in March, it'll take place April 1st. So these are your enrollment periods. Okay, it's your Medicare, it's your choices. Nobody's going to tell you what you have to do, or we can tell you what you can do. We're not going to tell you what you have to do. Anybody got a headache yet? I don't blame you if you do. Okay. This is where we get into more of the details. What do you need to think about if you're getting ready to start Medicare? Are you retired? Do you have retiree insurance? Can you continue that retiree insurance? Is that retiree insurance, if you have it, affordable? Are you looking for something that's maybe a little lower cost? Do you have a spouse that's still working and plans on continuing to work? Can you be covered under their health insurance? Do you plan on traveling or spending parts of the year in different locations? And you're like, Chris, why are you asking me all these questions? The reason is, if I have somebody come in and say, I'm going to live here in Southern Illinois in the summer, and I'm going to be in Arizona in the winter. I am not in any way, shape, or form going to recommend a Medicare Advantage plan for them because it will not work. Medicare Advantage plans have a network. You have to get your services in a network. Network of hospitals, doctors, labs, etc. I am going to point them more in the direction of probably a supplemental if they don't have retiree coverage. Supplementals are nationwide. If someplace takes Medicare, they're going to take the supplemental on that. If somebody tells me, I'm going to travel, but I don't plan on being away from the area, more than maybe a month and a half, 6 weeks at a time, then maybe a Medicare Advantage plan might work for them. Don't know. My husband's big, bold idea is to take his 1925 hot rod and drive it to all the national parks. Okay? Not exactly Chris's idea. Because Chris has seen what he looks like when he gets out of that driving 2.5 hours. He's walking like this. If anybody remembers the old character actor Walter Brennan, he walks like Walter Brennan when he gets out of the car. So, he fixed that problem and went out and bought a 1963 Thunderbird for us to travel in. I'm like, okay, I could do that. I could sit in that car. So you want to know what you want to do. The other thing to remember is you are not permanently locked into any one thing. There are always options to change. You may have to wait until the annual enrollment period, but you can change. We just talked about that. Okay, so what can you have? You can have original Medicare Part A and nothing else. You don't have to get anything else. If you don't pick up B, you're not going to have coverage for doctor's office visits, lab tests, x-rays, etc. You can have original Medicare A and B. So then you've got hospitalization and medical. You can have A, B, and D. So you've got hospitalization, medical, prescription drug coverage. You can have a Part C Medicare Advantage plan with or without prescription drug coverage. You can have Part A and B with a supplemental. And you can have think about supplemental. You can have A, B, and D. So you've got hospital, medical, prescription drug coverage, and a supplemental. Supplementals do not include prescription drug coverage. Prescription drug coverage is separate. We may have a few people left that bought a supplemental long time ago that has prescription drug coverage on it. And then you can have A and B with employer or retiree insurance. Or you can have, if not your employer or retiree, a spouse's employer or retiree insurance, depending on who you work for. A little more about Medicare supplements. What they are. You'll also hear them called Medigap plans. And they fill in the gaps of Medicare. They fill in that $1,736 for Part A. They can fill in your Part B deductible. I tell people to think of Medicare as like a can with holes in it. And a supplement comes in and can wrap around and cover some of those holes for you on that. You pick the coverage you want. There's multiple plans. You can pick what they do cover, what they don't cover. It's up to you. That way, you pick the coverage you want, and then you can look at plans. Because if you just called up Blue Cross Blue Shield and says, I'm interested in your supplemental plans, well, they're going to start talking, and they're going to start all the different plans and all this. And you're going to go back to that original cartoon where it's just blah, 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 when you hear it. But if you can sit down and go through and say, this is the coverage I want, you can call up Blue Cross Blue Shield and you said, I am interested in your G plan. What would be the cost? So now you're literally comparing apples to apples on that. And for years, it was page 7. Now it's page 13 on here. The state of Illinois puts this out. It's called Medicare Choices. It has this cool little chart in it. The chart has all the different Medicare supplement plans available in the state of Illinois. Or actually available anywhere. And then what it covers and how it covers it. So you can go through this chart and you say, okay, yep, I want it to cover this. I want to cover my Part A deductible. It doesn't have to cover it all. This one covers it at 50%. I can do that. I can cover 50%, they can cover 50%. So I want a K plan. So So you call up the insurance companies and this. We can help you enroll as SHIP counselors in a Medicare Advantage plan or a Part D. We cannot help you enroll in a supplement. We can help you look at the supplements and decide which supplement you want, but we cannot help you enroll because it requires a licensed insurance broker. And we are
So
not.
you buy those on your own?
Hmm?
You buy those on your own?
Supplements?
Yeah.
Yeah, you could come in and talk to a SHIP counselor, and we can help you figure out what kind of coverage you want, and then you can go to the insurance broker and say, hey, I'm interested in a K plan, supplement plan. What kind of price can you give me? And then they can work it that way. But you could go in without them throwing, well, if you get an A plan, this, too much input, and people tend to shut down. Think about taking a small child into a candy store and telling them, you can have one thing, what do you want? And they just walk around going, I don't know. I don't know what I want. The same thing I have seen happen over and over. When I can tell when I'm throwing too much information at somebody. The eyes glaze over. They've gone somewhere else. They're planning their vacation. They're not paying attention to what we're talking about anymore.
What's considered the gaps of Medicare, though? What would be the gaps?
The gap would be, so for Medicare Part A, when you have a benefit period, we talked about the $1,736 that you would owe if you went into the hospital. That would be one of the gaps. And you can get a supplement that will cover that $1,700.
If you don't have that, you're just paying out of pocket.
Yeah, exactly. The Medicare Part B deductible of $286. It can cover that. It can cover your day 61 through 90 copay if you're in the hospital. So all of those different things that Medicare doesn't. All your Medicare B, the 80-20, where Medicare pays 80 and you're responsible for 20%, you can get a plan that will cover that 20%. So you don't have to. We used to have a Plan F supplement, and I always called that the Rolls Royce of supplement plans. Because you had no payments. You had no out-of-pocket with those plans. Unfortunately, they quit selling those in 2019. So, here's a perfect example. My aunt lived in Southeast Missouri. Had to bring her up to Barnes via ambulance because of her heart. She had a Plan F supplemental. Thank you. That ambulance ride from Southeast Missouri, Poplar Bluff, Missouri, to Barnes Jewish Hospital in St. Louis was over $7,000. She paid none of it. Now, she paid a hefty premium for that supplement. She was paying about $240 a month for that supplement. But I didn't care because that one ambulance ride and then the 2 heart surgeries, she paid nothing out of pocket. So that's the gap. We've got one that's similar, but it's got a few more deductibles in it now. On that. Okay, so as we already talked about, once you choose what kind of coverage, then you decide which company you want it from. For the most part, a Plan K is a Plan K is a Plan K. It doesn't matter if you get it from Blue Cross Blue Shield, Royal Neighbors of America, United Healthcare. There are a few things, but they're the same. The biggest difference is what they charge you per month. Could you do me a favor? Turn that fan on. Thank you. Okay, that was supplements. Now we're going to talk about Medicare Advantage plans. Medicare Advantage plans, also known as Part C, is another way to get your Medicare. I tell people, original Medicare is pepperoni pizza. You get it sliced in triangles like Pizza Hut does. A Medicare Advantage plan is the same pepperoni pizza, but you cut it in squares. It's still the pepperoni pizza. You still have Medicare. You still have all the rights, privileges, and protections of Medicare. You're just getting it served in a different manner on this. When you choose a Medicare Advantage plan, you are choosing to abide by the rules of that company. So, I'm going to pick on Essence right now. I choose to go into an Essence Medicare Advantage plan. I have no additional premiums. I sign up for it. I abide by their rules. I still have the protection of Medicare behind me. Essence has a contract with Medicare to provide this Medicare Advantage plan. So I am still protected by Medicare. But it works different. If I go to the doctor, I have a copay. I don't have a $280 copay immediately. I have a $20 copay. If I go get a diagnostic test done, I have a copay. If I don't go to the doctor, I don't get x-rays, I don't have any copays to pay. So it works out. It's kind of a la carte. If you use it, you pay your copays. If you don't use it, you don't have any copays to pay on this. With a supplement, you're paying a premium every month. With a lot of the Medicare Advantage plans, there are no premiums. We already went through this. The health maintenance organizations, preferred provider organizations, private fee-for-services, and special needs plans.
Then, Chris, so then why are the insurance companies pushing the Advantage plans so much if they're not getting premiums up front? The brokers are pushing those and pushing those.
They don't get premiums from you as the beneficiary. They still get premiums for Medicare. So, we talked a little bit about the $202 everybody pays for the Part B premium. That's roughly 25% of what it costs you to have Medicare Part B for a month. The other 75 is what comes out of the Medicare Trust Fund. Everything that we pay into when we're working, you pay your Medicare tax, you pay your Social Security tax, that goes into the Medicare Trust Fund. That pays your other 25%. So when I enroll in a Medicare Advantage plan, they take my $202 and whatever the other 75% would be, because my brain is not mathing right now, and they send that to the company and say, here you go. And it used to be a lot that I enrolled at Essence, so my premiums get mailed to Essence by Medicare every month for Essence to be my insurance provider. Medicare doesn't see my bills anymore. The only place that sees my bills is Essence, and Essence deals with them in the manner that they said they would. Year rolls around, I stay with Essence. They used to have retention bonuses. Oh, Chris stayed with you. Here, Essence, have some more money. And things like that. They would also get some sign-on bonuses if they signed up. Oh, look, Chris signed up for your plan. Here's a bonus on this. When the Insurance Act went through that was saying that it was 85% of every insurance premium dollar had to be spent on insurance, on medical care, Medicare Advantage plans had a lot of money they had to pay back on that. So they're still getting paid. That's how they do it. That's where their money comes from. It just doesn't necessarily come directly out of your pocket. But it does, because you paid into it. And so they're still getting their premiums on that. So other coverage,
They also, just to follow up with that, the Medicare Advantage plans control a little more when you go to the doctor and which doctors you go see, because it's networks of doctors. With the supplement plans, you can go see any doctor that takes Medicare and then they pay the supplement pays. The Advantage plans, you're using networks of doctors that they have agreements with and contracted rates. So it keeps their costs down.
yeah, and they're also the ones that if you have to take a referral, you go see your primary, you have to get a referral to the cardiologist, or the pulmonologist, or the endocrinologist, or any other ologist out there for that. And by the way, let's just introduce Mrs. Schmicky and Tabitha Mays, two of our SHIP counselors here. I guess April's got appointments. April's got appointments. So we have 3 SHIP counselors on staff here for this. Okay, other coverage to look at. Your retiree coverage. Again, if do I have any federal retirees in the room? Okay. Do you have FEHB benefits?
Yep.
Federal Employee Health Benefits? I'm gonna make it real easy for you. You don't have to do anything. If you're gonna keep your FEHB, you don't have to do anything with supplements and Medicare Advantage and all that. Go through OPM. You don't have to have any other coverage on that. Other plans, it may get more expensive for you. Yeah, you're done. You're done. But nice seeing you. Thanks for coming. on that. Thank you for believing me. My mother didn't when I told her. She's a federal retiree also on this. So, retiree coverage. Sometimes it may be too expensive. Sometimes the rates go up. Sometimes they don't, and they're fine. If you have it, you've got it. Make sure before you sign up for anything, if you have a retiree coverage, check with your HR, whoever does the insurance where you worked, that if you sign up for something, it could possibly kick you out of your retiree insurance. And getting that retiree insurance, with the exception of federal, can be darn near impossible. We did it one time, when MedD first started in 2005, 2006, we had a gentleman that had retired from John Deere. And somehow he got signed up for a Part D plan, which kicked him out of his full John Deere retirement. It took us 4.5 months, but we got him back in as an heir. Also make sure, if your spouse is covered. Sometimes that's what comes in. The retiree insurance for the employee is fine. It's adding their spouse that becomes really, really expensive. And then there's Medicaid. Medicaid has a couple of different programs. They have what's called Aid to the Age Blind and Disabled, AABD. That's full Medicaid. Some people maybe, if they meet income and asset limits, maybe qualify for that. There's also a Medicare savings program for lower income individuals that will help pay Medicare Part B premiums and pick up what Medicare doesn't pay. So if somebody qualifies for the top tier of the Medicare savings program, they can have their Part B premium, that $202 a month, paid for by the state of Illinois, and the state will pay what Medicare doesn't on that. So there's a couple of different programs for lower income individuals. But if they qualify for the Medicare savings program and they get the $202 back in their Social Security check, they also qualify for the low income subsidy for their prescription drug coverage, which can lower or eliminate their Part D premium and lower their copays for their prescription drugs. So you're looking at roughly $240 that can go back in a person's pocket. Okay, what if I'm still working after the age of 65? If you're still working after the age of 65 and you have health insurance through your employer, you're fine. You can go ahead and pick up A. A's free if you've got 40 quarters in. I tell people, why not? Get your A. You can postpone enrolling in Part B if you have full insurance coverage, and then go back at a later date. If you have coverage through a current employer who has more than 20 employees, you're fine if you don't pick up your B. If an employer has less than 20 employees, then you must pick up Part B. So, for those of us who work here at AgeSmart, we have employer health insurance offered. When we turn 65, we have to get both Part A and a Part B, even though we are going to continue to work and have insurance through our employer, because we have less than 20 employees here. The reason for that is to take some of the pressure off of the smaller businesses with insurance. So our bills will go through both company insurance and full Medicare. So, when I turn 65, and if I am going to continue to work here, less than 20 employees, I'm planning on it, but if I'm still here and I'm going to continue to work, and I choose not to take Medicare Part B, I know better, but let's just say I don't take Medicare Part B. And I continue to work, say, for another 3 years. And I go to fully retire. I will no longer have insurance through AgeSmart. I go to pick up my Part B. I go to Social Security. It says, hey, I'm working, I need to pick up my B. The first thing they're going to tell me is come back and see us in January, because it's not general enrollment. The next thing they're going to tell me when I go back in January is, okay, so at 65 you were eligible for Medicare, you're now 68. That's 3 years later, Chris. You have a 30% penalty for your Medicare Part B premium, which means whatever the Part B premium is when I retire, and when I go to get my B, I'm going to pay 30% more than everybody else, because I chose not to get B when I was first eligible.
And that's not just a one-time.
That is not one, that is mine for life. That is mine for life on that.
I have a question. So you said, if you're still working full-time, even at 65, has not retired, you said you can postpone.
If your employer has more than 20 employees. Yep.
So, again, so now your scenario you just gave, at 68, okay, now I'm gonna retire. I want my 4B, with retirement 4, so I won't have to put it in there, right? Because
Correct. She just took the next part of my presentation. You got it. You got it. What she was saying is, in the scenario I gave. So say we had 150 employees here at AgeSmart. At 65, I'm going to continue to work. I don't take my B. We've got 165 employees. When I choose to retire, no matter what month of the year it is, now, I go to Social Security, and most people know at least 30 days out before they retire. Most people don't wake up on Monday morning going, I don't see myself going in, forget it, call in, and go, I'm never coming back in. They usually 30 days with it. Until you go to Social Security, and I can go into Social Security, I can actually print out the form online. I fill it out. Whoever does HR here fills it out. I go into Social Security and I say, hey, I need to get my B started. So it's, say, the 1st of July. I said, I need my Medicare B to start August 1st. They look at the paperwork, it has my name, when I want my Part B to start. HR signed off that, hey, in the last 3 years, Chris has been covered under our insurance, everything's cool on that. They process it. I get a new Medicare card with both hospitalization and medical on it. I have no penalty because I was fully covered the whole time.
So do you have to provide a letter from your employer? Because that's what I was told.
The employer has to sign off on the official Social Security form. I think something like a 2348. Don't quote me on that form number. But you print it out. It's basically your name, address, your Social Security number, a note box that you just put on there. Want my Medicare Part B to start, whatever date you want it to start. And then your HR company signs off on the bottom. Your HR people sign off on
And
the
when you
bottom.
quit working, there's a certain amount of days you have to do this. Is it like 60 days?
Yes. Yeah, you don't want to let it go. That's why I tell people, as soon as you know when you're going to retire, as long as it's not 8 months out, 8 months out. You know, if you're in the 90-day range, you want to get that paperwork to Social Security as quick as you can. Because sometimes, you also want to get that paperwork to your HR people as quick as possible. Because there's some HR people that will drag their feet on it. And drag their feet. For whatever reason. Because all they have to do is say, oh yeah, for the last 3 years you've been covered under our insurance, here. Go on it. And as long as they've signed off on it, Social Security's like, okay, cool. And then they put you in the system.
So you continue to work when you're 65, but you take your Medicare A and B, you're paying your B premiums. Are those Medicare income taxes still going to be deducted from your paycheck?
Yeah. Because what happens? So we'll step out of Medicare real quick and step briefly and dip a couple of toes into Social Security. Your full retirement age is not 65. It's like 66 and 7 months or 8 months right now. Yeah, I don't memorize it because I have a little chart on my desk for that. I think my full retirement age is 68, 67 is on that. So you go out at 65, they're still going to do it. But you're not getting a check from Social Security. Say you're just getting your Medicare. you're not getting a check. When you go to apply for your check, everything you kept working is going to be factored in to how much your Social Security check's going to be. They're still factoring all that money in. It's not like it stops. And up until the age of 70. And 70 is when it is a mandatory requirement to take your Social Security retirement payments. And they will notify you that, hey, you're 70 now, it's time to take this check. Because there will be no more additions or subtractions to it on there. So that's our slight dip into Social Security. If we need to dip any more, I need to call somebody on that. Okay, so we went over if you're still working. Is that clear to everybody? Because this is the one place where you could end up with penalties. That's why I want to make sure you're clear.
Let's have a question about your deductible. Say you are working and you quit working, you start your Medicare, say in the middle of the year, and you met your deductible with your employer while you were working.
You're going to meet it again with Medicare.
You have to meet your new deductible with Medicare. Say you met a $3,600 deductible with your employer. You have to meet a new. Medicare doesn't recognize.
Yeah, Medicare. I never had Medicare recognize an employer.
Basically, it's new insurance. You're going through your company, so no.
Okay, thank you.
Now, if you switch Medicare plans for some reason in the middle of the year, it will.
Okay.
I would also recommend don't walk into Social Security. If you know, no, I'm serious, if you know when you're ready to retire, call them and make an appointment. Because they're not going to, you call on a Tuesday, they're not going to see you on Wednesday.
And
It's going to be a minute before you can get an appointment.
like Chris said, if you know 90 days before, call them 90 days before, because the last person that I sent to call them, it was 6 weeks before they could get an appointment. So call well in advance.
And don't walk in because they won't see you.
Now, I will tell you that the Social Security office, well, I can't see up one of his. If I had a really good arm, a little better arm, I could probably hit him with a baseball, throwing it from here. The Social Security office is right back here. It's actually in West Point office complex. We're in Bronze Point right now. West Point's next door, but they're in the far back. They're in the same building as the vet center. But we did have a consumer come in and try to go into Social Security to make an appointment, and we're told they had to have an appointment to make an appointment. And we were like, you have to have an appointment to make an appointment? How does that work? We try not to have on that. So, if you're working, your company has more than 20 employees, you don't have to take B if you're still working, if you have employee insurance. If there's less than 20 employees, you have to take your B. If you have less than 20 employees, do not let Social Security tell you you do not have to take B. We had a receptionist here. We sent her to the Social Security office. I wrote down everything she needed to tell them. She was back, she goes, I don't have to take B. I'm like, yes, you do. Sent her back 2 more times. I ended up calling a regional Social Security person and saying, okay, this employee didn't take B, and she was penalized for it, and she's now paying 10% more. This one's trying to take it, and you're telling her she doesn't have to. One of these is right, one of these is wrong. I just want you to tell me which one. And they proceeded to tell me that I was correct. It hurt them to tell me that. But I also found out that this particular staff member of ours was not talking to a full claims representative of Social Security. She was talking to a friend who was an SR, meaning that person worked the front counter, answered the phone, and took paperwork when people dropped it off. They were not claims rep. So, okay. Who can answer questions about your coverage? Because, you know, sometimes for me, talking to an insurance agent, kind of like talking to a car salesman. I get confused, and they're rattling off, and they're machine gunning information at me, and I'm like, stop. Well, There's certain people you can talk to. You can talk to Social Security. If you can get a hold of them, there's a wait time. You can call the 1-800 number, even if you call the local number. Because for some reason, if you call the local number, it will, after a certain amount of time on hold, kick you to a national number on that. There's also the Railroad Retirement Board. Railroad Retirement Board cards look a lot like Medicare. They work a little different than Social Security. And then there's the Centers for Medicare and Medicaid Services. Do not call Centers for Medicare and Medicaid Services prior to having Medicare. They can't help you. Yeah. SHIP counselors. You've met two of our lovely SHIP counselors. We have one more, who's just as lovely. SHIP counselors. Senior Health Insurance Program. SHIP as in Paul, not T as in Tom. I've had people mishear me, and I had one gentleman yell it out really loud, go, that's a stupid name for a program. And I'm like, well, I got to agree with you. Way too fast. Senior Health Insurance Program is a federal program that helps train Medicare counselors. We do not charge. We give you unbiased, confidential information based on your situation. On that. We have gone through a training with the state. We all have binders this big with all the information in it that we have gone through. We have update trainings every year to keep up to date on all the changes. We are on email lists, way too many email lists sometimes on this. But we can sit down with you, talk one-on-one about your specific situation and the direction that you may or may not need to go. Now, if you look at one of the SHIP counselors, you say, Tabitha, which plan should I pick? Tabitha, which plan? Tabitha's not going to tell me. Missy, what plan would you pick if I was your mom? I used to tell people, my mom has federal employee health and benefits, so she's in a different boat. On this. We will sit down with you during annual enrollment if you want to switch your Medicare Part D or your Medicare Advantage plan and go over the options that are out there. Medicare.gov has a comparison tool on their website. You can do it, you don't have to log in, you can log in, and it will save your prescription drug list. That's the same one we use. We go in, we put your drug list in, we see which plans cover it. If you're looking for a Medicare Advantage, you can look at the different Medicare Advantage plans that are available. We can help you, as SHIP counselors, enroll in a Medicare Advantage plan. We can help you enroll in a Medicare prescription drug plan. We cannot, again, help you enroll in a supplemental plan because we are not licensed insurance brokers. We have signed agreements with the state of Illinois that we do not work with or for any insurance company. It doesn't matter, if you take Blue Cross Blue Shield, Humana, Essence, doesn't matter to us, we're not getting anything out of it. Our goal is that you have the insurance coverage that you need at a price you can afford. Okay, so, in summary, coverage choices are varied and depend on the individual and their circumstances. Questions can be answered by a SHIP counselor. We're not selling you anything on this. It's your Medicare, so they're your choices on that. We will answer your questions all day long. You are not stuck in your first choice. If your needs change, then your coverage can change also. Medicare A and B are going to be Medicare A and B. Your Medicare Advantage plan can change. Your Part D plan can change. Your supplemental plan can change. This is us. This is how you get a hold of us. 222-2561. And you tell them I need to talk to somebody about my Medicare, and they will get you in with one of our SHIP counselors here. If you do not live in the immediate vicinity, we have SHIP counselors in 7 counties. Bond, Clinton, Madison, Monroe, Randolph, St. Clair, and Washington. We have SHIP counselors in Millstadt. We have SHIP counselors in East St. Louis, Alton, Greenville, Trenton, Carlisle, Sparta, Chester, Waterloo, where you can find the closest SHIP counselor for you. Thank you very much. Any questions? Oh,
Yeah, I do have a question about medical equipment. Is there a limit on how much medical equipment you can get from it? Like, because I've heard, like, they gave you a walker. Well, now, 6 months later, now you need a wheelchair. Are they going to cover both of those in 1 year, or is there a limit?
again, if you follow medically necessary, doctor authorized. So if it becomes medically necessary, then the doctor's going to authorize it. And yes, you should be able to do it. The caps I've seen are somebody got a wheelchair and 6 months later they're trying to get another wheelchair. It's like, well, where's your first wheelchair? And that's why I tell people, especially those on Medicare, if you are given durable medical equipment, my mother was given a walker 4 years ago. And she goes, okay, well, she says, take this and donate it. And I went, no, ma'am. You are on Medicare now. If you need that walker later, we're going to have this walker in the garage. It's not eating anything. It's not taking up, doing nothing but taking up space. So I tell people just keep them until, because if they need them in the future. Any other questions for me? Yes.
Is Medicare any dental or vision at all?
No.
Okay.
Because according
You don't need your eyesight or teeth, your
there has been legislation in the federal government in the last 6 to 8 years, and they jokingly named it seniors have ears, eyes, and teeth too. And part of what's come out of that, if you see the ads for the over-the-counter hearing aids, that's kind of part of what has come out of that legislation. They haven't done anything about the dental and the eye vision yet. That's another reason Medicare Advantage plans are attractive to some people, because some of them do have little bits of dental coverage and of eye coverage, eye exams, and sometimes they'll throw money toward her glasses on that. Anything else? Did I get all your questions about supplementals answered? You got state priorities. Okay. Yeah. And that works a lot like the federal does too, with some changes. Okay. I would thank you all for coming. Spending some time on this. Our last session of the Smart Aging series will be in 2 weeks. We have Brad Leviti from the Madison County Veterans Assistance Commission coming in and talking about what services are available for veterans and how to apply. So,
When is
Are
that?
those books?
24th? 24th. June 24th.
Chris, are those
Yes,
books
you
for
can-
us to take?
You can have those books, yes. The books?
Mm-hmm.
Yeah, okay.
We've got some extra ones here. If anyone's interested, I grabbed some. I stole them out of Missy's office.